I like to talk about some very important short bits of information, which I like to call Dr. Earle's nuggets. These are very often not discussed, and so the patients don't know what to expect. So I like to give these out front so the patients have a better understanding of these things post-operatively. The first one is numbness to the hands after a BBL. This is actually fairly common, but it's not really mentioned anywhere. So when patients feel this, they get very, very concerned, especially numbness in the small and ring fingers. And this is commonly due to the way that you're positioned after a BBL. So since you have to be face down for approximately 6 weeks or extended period of time, you get pressure on what's called the ulnar nerve near the elbow. This is the nerve that innervates the half of the hand with the small and ring finger, and therefore you develop numbness, but almost always it will go away once you can adjust your position. The next important nugget of information has to do with your implants. So when you place a breast implant, they're typically going to end up very high and they're going to feel very, very tight. So it takes about 3 months for the implants to drop. This is going to be a slow, gradual process that everyone is going to go through. The next bit of information is called pleating. This is actually when the skin kind of folds upon itself. It's very, very common after a tummy tuck or in the lateral incisions of a breast lift or breast reduction. When patients first see this and they don't expect it, they get very, very concerned. But the good news is that pleating will always go away, but you have to give it about 3 to 4 months to smooth out. The next bit of information is that we commonly get the question whether silicone implants are just as safe as saline implants. There's a little bit of confusion out there where people believe that the saline implant is safer, but actually there's multiple studies that have demonstrated that they are equally safe, and therefore I highly recommend the silicone implants because not only are they equally safe, but they provide a much more natural look and feel. And lastly, this is very, very common after a breast reduction or a breast lift in the anchor type pattern. There's a spot right down the middle where the horizontal and vertical scars meet. We call that the triple point or the upside down T point. It is very, very common for that to sometimes open up, create a small wound about 1 centimeter or so. Typically, we just treat it with antibiotic ointments and dressing changes, and it'll close on its own. And the final nugget of information is a wound that can develop sometimes after a breast lift or breast reduction when you're using the anchor type scar pattern. So at the triple point, which is where the vertical and horizontal scars meet, sometimes that area can open up a little bit, about 1 centimeter or so. Typically, we just treat it with antibiotic ointments and dressing changes, and it tends to close on its own.